Thank you so much. Welcome, Bobby. It's great to have you here.
It's great to be here. Thank you. It's good to see you, Lucia. Good to see Michelle again, and great that you guys are engaging this very important and timely project.
Thank you. So, Bobby, what do you think as an LCSW that what are some possible reasons for vaccine hesitancy in different communities?
You know, that's a really good question because that's something that I think right now we're really currently struggling with is the vaccination rates, obviously, not only just in California, LA County, but across the country. You know, we have the solution. We know that vaccines are effective. And there's been a lot of research and a lot of kind of information that has been kind of disseminated to various communities. But we see that still a lot of communities are struggling and being disproportionately affected by this kind of Delta variant research, specifically communities of color. And so I guess the question becomes, why is there a hesitancy there? You know, I think the answer is complex, but I would say that in certain communities of color, one element might be is that there might be kind of a history, an ongoing history of trauma resulting from various systems that communities are interacting with, right? Whether it be kind of medical systems that have not been really accessible or have not really provided comprehensive or adequate care, you know, not being able to connect with health insurance, you know, not having the ability to connect with consistent financial opportunities. And then, of course, all that ties into with educational opportunities, right? So if you've limited college, limited ability, education at high school or science, all of these things can potentially contribute towards your, you know, maybe hesitancy towards vaccines. But specifically, I think in marginalized communities, they felt very victimized and maybe in some ways traumatized historically by a lot of policy. And I think, you know, as we're trying to roll these vaccines out, that it makes sense that a lot of communities are hesitant, that a lot of communities are really worried that, you know, is something, you know, are these vaccines safe? We've been lied to before. We've been let down before by various systems. If we get sick, do we have health access? Can we go to the doctor, right? Some communities don't have access to a doctor too. So to then get a vaccine that potentially has some side effects, and you might get somewhat sick, even though it's low probability, but there are stories. And I think for a lot of patients that don't have the education, that don't have the science background, it's difficult to integrate all of that. And I think it creates anxiety and fear. You know, and again, a lot of patients who in communities who are in marginalized communities, you know, there is high levels of, you know, trauma and adversity and fear in those communities that I think with these transitions and public health policies that have been so rapid and so quick, I think it's been hard for communities to kind of you know, get on board with the vaccines. But then there's communities, for example, that are also not you know, they may not be marginalized. We see a lot of communities, let's say in you know, let's say Orange County, where, you know, there's restaurants or there's community centers that are saying we welcome those that are unvaccinated, because I think the vaccines have become such a political or politicized, unfortunately, thing. And I think in this country we really struggle with implementing kind of community and public health and social work measures. They're seen as government trying to kind of get in our way of our independence, or government dictating what we should put in our bodies, right? And I think as Americans, we all hold on to this and embrace this idea of this individualism, right? That is can lead to so many positive things and creativity, but can also be so detrimental when we're needing to roll out these kind of more community-based programs, and you have people that are really resistant to any government imposing anything on them. So I think in both, it's anxiety, it's fear, it's a politicization, it's previous trauma that all kind of boils into that the response to that answer as to why people are hesitant. And I think also, because it's new, I think the primary emotion of the brain is fear. And I think with vaccines, there's been a lot of fear because it's happened so quickly. With a lot of the other vaccines, historically, they've taken years to roll out. And there's been decades of experience that we've had with rubella and mumps and flu vaccines. But this vaccine is somewhat new. And, I think there's now with Instagram and social media, there's been a lot of people sharing their stories about how they've really felt sick, or some people have had adverse reactions. And I think, again, people don't have the science background and understanding to recognize, well, that's just one person out of like 3 million. And so it's hard for people to kind of have a sense of that. I think public health has a really major problem. We've always had this problem in terms of how do we disseminate policy into the community, and specifically vaccines, because even before this, it was all the vaccine hesitancy about autism, right? Like vaccines cause autism. And that's another element, right, that to put into the equation, that these vaccines, will they impact my unborn baby? Will they cause risk for neurodevelopmental disabilities? All science currently shows that it's safe, but honestly, we haven't had a 10-year study on these vaccines, right? So I think there's a certain level of anxiety there that is warranted.
Absolutely, Bobby. You touched on so many different levels of where vaccine hesitancy is coming from, and how COVID-19 really was unprecedented. And we had no idea how everything was going to look days, months, years from now. We know mental health was impacted due to COVID-19 in many ways. In what ways do you think that has played a role with people's vaccine hesitancy?
Mental health?
Yes.
Yes. Well, I think it's similar in nature to other kind of healthcare maintenance, right? Like, for example, we all have to go to the doctor. We all have to eat healthy diets and exercise and lead healthy lifestyles. And even pre-pandemic, I think this was something very difficult that we were seeing in marginalized or under-resourced communities, right? Because in these communities, as we're saying, there's high levels of disruption, there's high levels of trauma. There's also just a lacking of resources and education and cultural norms, maybe, in the communities. So as a result, it's really hard for people to engage in healthy lifestyles, right? And especially if you're depressed, as we know that certain communities have experienced, again, traumas and adversities that predispose them to mental health issues, that mental health, like depression, will play a major role in how you interface with the medical system, right? And we know that depression, if you're depressed, you're less likely to follow up with medications, you're less likely to follow your doctor's recommendations. And I would say that the vaccine falls under that, right? So if you're depressed, you're less likely to potentially want to, stand in line for an hour. I know when, for example, families had to initially go to it's easier now, but for the vaccine, you had to go, take a whole day out of your schedule, 3, 4, 5 hours to go stand in line to get a vaccine. And if you're depressed and can't get out of the house, that's going to be a hard thing to do. If there's others like anxiety from a standpoint of just like childcare, or anxiety about losing a day's worth of pay because your housing situation is so unstable right now because your work is unstable, getting a vaccine is going to be really hard because logistically, it may take you a day to get it and a day to recover, and that's maybe time that you don't have. So I think the mental health, like depression, but I think anxiety about, I think so much anxiety right now about what's going on, and just surviving and finding employment and housing, that I think that in itself sometimes can, for a lot of, I think for people that have more privilege and more resource, we don't understand that, the hierarchy of needs, and a vaccine may not be at the highest for someone. It might be, I need to eat, I need to pay the rent, or I can't pay the Uber to get across town to the vaccine center. So we have to realize that the stress related to survival, sometimes may get in the way of actually adhering to some of these recommendations, public health recommendations, because there's, mental health and obviously environmental stressors that people have to kind of address first.
Absolutely. You mentioned several different things that made me think about, when you talked about depression and motivation at the very beginning with COVID-19 vaccinations, you had to schedule your appointment 2 weeks in advance. And then the day of, you had to even allot 3 to 4 hours. You also had to have a vehicle because some of them were just driving.
Computer.
You had to have a computer. Yeah, absolutely.
And none of those platforms made any sense. I was like, I'm educated. I have, UCLA educated, masters, and work with doctors, and I had to book the appointments for my older family members who didn't have computer literacy, and I couldn't do it. So I can't even imagine someone in a community that doesn't have internet, maybe just has a phone. The websites weren't user friendly. It's still a little unclear. What do you do do you just walk into a pharmacy? The other thing I'm going to add to it is you got to put your name down. You have to give personal information out. What about the families that have citizenship issues or their residency, right? And there's a lot of politicizing right now about that for immigrant populations. I don't know if all of a sudden I want to go disclose my personal information or I want to stand in line. Am I going to be on a record somewhere? Are they going to come back and have an address for me? So that's another kind of level of anxiety, but warranted, right? Given the political nature that we face right now.
You mentioned immigration status, and that also made me think about language and how for some communities their language may not be English because it may just not be. And so that could have also been another potential barrier. In what ways do you think that these barriers were compounded for the disabilities community?
Oh, I think significantly, right? One, I think of concern for our disability communities is that oftentimes people with disabilities also have complex health issues, right? They have other coexisting medical challenges and vulnerabilities that makes it especially important for them to get vaccinated. Oftentimes, people with disabilities are really connected, and it's important that they have access to their interventions, whether it's like behavioral therapy, whether it's kind of group activities through the regional center, and all of that stopped. And the big concern for our populations with disabilities is that they were disproportionately affected with the pandemic because they're so dependent on the services, the service providers, healthcare providers in the community, school services, and all of these things just went away, right? But in terms of vaccine, hesitancy, I think I think first and foremost, we have to acknowledge that the disability community is very, very diverse, and it's very hard to say this is the reason why for the disability community. I think that the answer is going to be complex because there's so many different types of disability. And for example, talking about someone who has, let's say, autism but doesn't have an intellectual disability versus someone that does have an intellectual disability, right? Totally different set of issues there, because someone with intellectual disability, you're now talking about someone who maybe has less capacity to understand the science or understand consent, and maybe is more dependent on family to make those decisions, right? And what if the person may be okay with it, but maybe the family's not, but they have legal and medical conservatorship guardianship, and they're not wanting to make the call, or they're worried that because there's already pre-existing health issues that this might mean that there might be, problems for this individual with disabilities. So that's one issue. But I also wonder, much of, I think, the marketing and the kind of dissemination of information about the vaccine, we have to really question it. How accessible is it really to various populations? Because when we look at Is it accessible to, let's say, communities of color or marginalized or under-resourced communities? But we also have to ask ourselves the same question for people with disabilities. Is it, are the commercials or are the public health effort important? I haven't seen any of that. I'm sure if you dig enough in social media platforms and disability groups that is there, but I haven't seen it on the mainstream really broadcast in the way that it should.
Yeah, absolutely. I think that's something that part of the project has tried to be really conscientious about, is making that information accessible, because it's not very accessible and it's not very mainstream. In fact, one of our previous told us about the ways that Zoom had really upped their technology and including closed captioning for all accounts, because that wasn't something that they had in their original programming. And so in that way, it did become more accessible for many other communities where otherwise it wouldn't have been accessible. So you're absolutely right that there needs to be more specialized messaging for all groups that's inclusive of all communities, all populations, as opposed to just a general message that everyone is expected to understand and just digest. So absolutely.
Right. Yeah, and I think that's where we're at, right? I think we're at this position where the kind of initial public health information or waves of education about the vaccines and important vaccines, and we've gotten, you know, pretty far with that. But I still think we have, obviously, what's causing these challenges now is that a set of the population that has not been successfully targeted or addressed. And I think part of it is people coming from kind of more underrepresented, underserved communities, but then also I think potentially challenges within the disability community to help them. I mean, even when you think of access in the more, you know, uh, fundamental ways, like, well, maybe you have a disability and you don't have access to a car. Maybe, you know, I know for a lot of individuals with disabilities and autism, for example, the idea of getting a shot is so profound. You know, a lot of individuals with disabilities haven't even had blood draws or standard kind of blood panels for years because there's so much fear about, you know, needle anxiety or medical procedures because of sensory issues. Right. So that also is another kind of dimension that should be really addressed. It's just getting people that are typically afraid of just needles. How do you get them to feel more comfortable so that they could volunteer to take the vaccine? And that's a big challenge is that we see in the medical system, is working with families around these issues. I also think with disabilities, I think um, you know, we go back to children getting the vaccines, and that's important because they're all going to be going back to school. And now I think it's 12 and up that have been approved for the vaccines. And again, children live in the context of family, and there's children with disabilities living with parents that maybe themselves, they could take their kid to get the vaccine, but maybe, you know, there's some challenges there with family members as well that we haven't done adequate enough job of reaching out. And I think we have to consult with the disability community and really let the disability community guide the messaging for families and children to get the vaccine.
So the next question is, how has your training as a social worker helped you to address patients' concerns with the COVID-19 vaccine during the pandemic?
I would say that the social work training has been incredibly helpful because, you know, in social work, you know, I think if I were to, you know, quote unquote, be in charge, I would say that public health really needs to kind of take a page out of the social work training and philosophy, because it's all about meeting the patient where they're at, right? We have to be sensitive to their level of motivation. We have to be sensitive to their current kind of stressors in the community and what they've been through historically. Um, so, you know, meeting them where they're at, and really, I think building relationship with community. If you really want to have impact and change, the fundamental element is relationship. And if you don't have relationship with community or clients, you're not going to have any change, or at least your probability of change is going to be lessened. And as we start to kind of get into these populations that have not received the messaging sufficiently, or they're more hesitant, or there's all these other issues that we've talked about playing out, I think it's going to be really important to build a relationship with these communities so that we can get to a higher level or vaccination rate. And social work is all about the biopsychosocial, really understanding the kind of environmental context, understand the historical trauma context, the cultural context, and level of motivation, and then working within the patient's kind of with a relationship, helping the patient to kind of recognize and talk about what are the barriers, what are the challenges, and how can we talk about that in a way that's not punitive, that's not isolating or marginalizing, and it's respecting the values and opinions of the person, and respecting their autonomy and independence, and working within that structure to engage them. Because I think when we do that, we can get people to come closer to the idea of getting vaccinated, right? But it's when we start to become punitive, and I see a lot of messaging on media that I don't think is really helpful, and it's not going to necessarily move the needle in terms of these populations or communities that are kind of at baseline more hesitant. I think we really need to get into the community and do more work internally from inside out, as opposed to top down, which I don't think is as effective. So social work, I think, has a lot of good structures and strategies.
Thank you, Bobby. You remind me of in certain areas that are more rural and isolated, part of what the public health department does is they get community members to speak to other community members. They pay them, and so in that way they are educating them on what the vaccine is in their own language and with a more familiar face that they see as a more trusted resource that's also more accessible. So definitely agree with you that it has to be a more relational approach as opposed to top down.
Mm-hmm. Yeah, we think of like the promotoras model, which has been really highlighted. Yeah, and there's a lot of kind of spin-offs of that, but something like that would be really helpful for communities that are more hesitant.
What are some resources that you recommend to families who are vaccine hesitant?
That's a good question. I would say, I think the medical professionals can be really helpful, but again, we go back to, you may not have access to a primary care physician. But I know that there's been several counties that have information lines. There's been a lot of resources online, but again, do communities have access to those resources? Are they easily or culturally sensitive or neurodiverse friendly? Those are questions, right? I would say, is there a trusted individual in your community that has a position of leadership, whether it be a priest, pastor, whether it be a teacher, principal, whether it be someone that maybe you have access to that is, I think, responsible leader in the community that potentially you could consult with and talk about. But I know that, again, there's a lot of other traditional, like the CDC websites and local public health websites have set up a lot of pages for individuals, but I think sometimes that might not be enough. Information alone is not enough, as we clearly see. It's about relationship, right? So talking to community members whom you trust, maybe whom have had the vaccine, can be helpful to get more information. People within your community, maybe it's like for the Latino community, is it a tia, an uncle?
Our internet hasn't been collectively, working with us, but we think such a great interview. So thank you so much for your patience with everything. Mm-hmm. Thank you so much, Bobby, for your time.
Yeah, you're welcome.
We really appreciate it.
Yeah, thanks. I'm sorry that the internet was kind of rocky, but if you guys have supplemental questions you want to ask, I'm happy to meet with you guys and talk further.
Thank you very much.
Thank you, guys. Thank you, everybody.
Thank you.